My name is Drayton. I'm a pulmonary physician and an internist working in the South Bay for so many years. My first contact with Fulbright came in my office when the marketer from Fulbright came around marketing their sleep apnea devices. And at the time I mentioned that I snored and if they had anything for that, and they said, oh sure, come down to our place, have a look, and I think we can do something for you. Now, I personally had snored for at least 4 or 5 years, and it had gotten to the point where I thought I was sleeping fine, especially when my wife was out of town. But when she was there, she was just jabbing me in the ribs all night, and I couldn't sleep. And so I decided to explore this, and I came down, and the operation looked good. When I met Dr. Fulbright and he asked me what my sleep study showed, I told him, well, I just snore. And he gave me that look, like, you know better than that. I had a sleep study, and sure enough, in addition to being a snorer, I had some sleep apnea. The device that I was interested in was one of the oral device, the Mandibular Advancement Device that goes in the mouth. I tried it. He fitted me. I tried it. I've used it I've snored one night in the entire time that I've had it since then. My wife absolutely loves it. I get to sleep well whether she's in town or not, and I think it's just wonderful. As a physician, especially as a pulmonary physician, I treat lots of people who have sleep apnea. And one of the complaints or I guess one of the gripes that I have is that traditionally the insurances have approved the CPAP devices and nothing else. And what generally happens is, I guess at first everybody likes them, but when they're no longer sleep deprived, the non-compliance rate is incredible. They stop using them after a few months. And so these people, they get sick, they have to go in the hospital. And I guess in recent years now, Medicare and some of the insurances are now starting to approve the devices like I have. And once I had the positive experience with this, I've started prescribing those through Fulbright for my patients. I think when I look back over my experience with them and my patients' experience, first of all, they're in a great location. They're state-of-the-art. The people are so nice, and now when I send patients and they come back to see me, they just rave about how they've been treated. They rave about how convenient this oral device is now compared to the CPAP devices that they were intolerant of all along. So I really think that the majority of first of all, I think that the majority of patients who have sleep apnea and who snore, who are given CPAP devices, end up not using them, and that's bad. My guess is, and I will be able to tell as I have more experience, is that the majority of people who have sleep apnea are probably treatable with the oral device, especially the ones that are, maybe even some of the severest, but I'm convinced that the milds and the moderates, based on my experience, are going to respond to that in a way that's positive. And I suspect that as time goes by, that's going to become the preferred method of treating sleep apnea. So at a personal level, I'm very pleased. And professionally, I'm so glad that I discovered Fulbright Dental, and it's helped me and it helps my patients, and I just give them my highest recommendation.